And if we don't put some curbs, if we don't try to find ways where we balance the payments out, we're heading for trouble.
Although the prepaid healthcare plan appears to have gained widespread acceptance among employers, in general, opposition by the business community to government-imposed employer mandates remains strong.
Small business is opposed to employer mandates, government mandates, because we know that the free market dictates what we have to do to keep and find good employees.
Another fear regarding healthcare reform is that a government-administered program will create yet another bureaucracy. As Hawaii's prepaid plan has shown, that doesn't have to be the case.
The legislature had appropriated $250,000 and a number of positions, I think 10 to 11 positions. We never used those funds, nor did we fill those positions, because the Labor Department at that time was already implementing two other worker slash health programs, workers' compensation and the temporary disability insurance program. So what we did was utilize the people who were already there implementing these two other laws and had them do what was needed in terms of making sure that all employers complied with the Prepaid Healthcare Act.
The Labor Department continues to oversee the program.
We have 10 employees involved in administering Hawaii's prepaid healthcare law. 2 of those employees on a full-time basis and 8 others on a part-time basis. So here in Hawaii, it has not created another bureaucracy to administer the provisions of our prepaid healthcare law.
General consensus among the experts is some kind of healthcare reform is urgently needed, given the ever-rising cost of healthcare and the large number of uninsured and underinsured people in this country. What is less clear is the shape healthcare reform should take.
In Hawaii, we need to have one thing that President Clinton is suggesting. That's an alliance where we can put groups together to form huge groups. As an example, there are about 80,000 government workers covered by the health plan for government workers. If you can put the 80,000 government workers in a plan with all of the private sector workers, then you can really get down to business and find out what's the best deal you can get. Right now, we believe that the government workers by themselves are not getting the best price they could get, and neither are the private sector people, because they've been disseminated by smaller groups.
I'd like to see the federal government determine and guarantee that every American will have a standard benefit package from birth to death, regardless of job change, whatever, that includes prevention, primary care, and all the other services all the way through catastrophic care. That there's a limit of out-of-pocket expenses for every American, that it's a one-tier system as far as health care is concerned, and that choice is preserved of health plan, of provider, and so forth, set by government standards, but implemented with a lot of flexibility to states in order to develop those systems, models, and the processes by which they go.
Healthcare reform isn't the responsibility of a few. We all need to work at it.
We spent a lot of time trying to get the guys to understand that, every time the kid has a sniffle, you don't have to run down to see some high-priced doctor, We try to encourage use of generic drugs versus brand names. We've introduced second opinions in many of our plans.
We're at the point now where the business community, unions, doctors, providers should realize that it's time we sat down and all headed in the same direction. And then the populace of Hawaii would benefit. Business should not be settled with the entire cost, but business has got to play a part. And I think they have to be able to work together with everyone else. And the unions are willing.
What employees have to realize, or even the whole nation has to realize, is say a small business has so much money in the pot. Now, if the employer has to provide and pay for the premium, then it's got to be something else has to give, like wages, like leaves.
Well, Hawaii may have universal access to health care. We still don't have universal coverage. Therefore, as health care reform picks up momentum at the national level, Hawaii faces the challenge of holding on to what is good and filling in the gaps.
Our population lives much longer, so we're having to take care of the senior citizens. And that's a major problem that we should be addressing right away. The National Health Care Plan will probably address long-term care, but it'll be a long time coming. I think Hawaii has got to forge ahead, adopt a plan. That'll be long range. What we're concerned about is that our legislature might say, well, since the president is putting out a plan, we should just wait. Well, we cannot wait, and we should not let other people determine our destiny. We didn't wait in 1974.
What we really feel we need to amend is the sunset provision of the prepaid health care, which presently provides that if there is a national plan, then Hawaii's prepaid health care plan would be abolished. We feel that we need to amend that provision so that we are able to retain the good features of our law.
Primarily for our patients, we like to make sure that they can maintain the choice and freedom to choose their own physicians. I think that's a big concern. And also at the same time be able to compromise on and to make sure the costs are held down too.
We really need incentives to business, and to labor, and to consumers to promote healthier lifestyles and healthier ways of living so we can reduce the overall cost by just being healthier.
We're talking about in healthcare reform of systems, how the systems will change and maybe need to change. We're talking about insurance plans and costs, but it still comes down to when care is given,
yeah, with the sniffling
it's between
such, I think
the provider and the
the
patient.
too.
And I hope sincerely that that will always be maintained. And that's the special part of being in medicine.
Healthcare has been treated as a commodity. It is as though it was something to be bought and sold on the marketplace, when in fact healthcare should be a right of every resident of the United States, simply because it keeps the body politic healthy, able to work, it stabilizes your workforce, and it gives people the feeling that government really does care for them.
The workers we represent are the roots of this huge tree. And if the roots rot and disappear, the tree will fall over and you'll have nothing. And we feel that we have to participate. We have to keep the community healthy.
As the debate over healthcare reform rages on, as we struggle to find ways to improve the system in Hawaii and the nation, keep this in mind. The United States still provides some of the highest quality healthcare available. I'm Dennis Chun for Rice and Roses.